Hello friends, one more important short note from the general anatomy is a cartilaginous joint. This is very important short note. Most of the time asked in the MCQ and viva में भी बहुत बार इस पे क्वेश्चन पूछा जाता है. जॉइंट्स चैप्टर में ये और साइनोवियल जॉइंट आर वेरी इंपॉर्टेंट शॉर्ट नोट्स. उसमें कार्टिलेजिनस जॉइंट प्राइमरी एंड सेकेंडरी कार्टिलेजिनस जॉइंट्स का डिफरेंस ये एग्जाम में हमेशा पूछा जाता है. नाउ द फर्स्ट डेफिनेशन, व्हाट इज अ कार्टिलेजिनस जॉइंट? इट इज द जॉइंट which are united by cartilage. Which cartilage? Either hyaline cartilage or fibrocartilage. So these are the type of joints which are connected. Two bones were connected by the cartilage. Okay, and these are either hyaline cartilage or a fibrocartilage. There is no cavity in it. They are either immovable or slightly movable types of joint. So primary is immovable, secondary is a slightly movable type of joints. So cartilaginous joints are the where two bones are joined or connected by a cartilage. And which type of cartilage? Either hyaline cartilage or a fibrocartilage. There is no cavity in this joint. Okay, and these are either slightly movable or immovable type of joints. Now they are classified into two types. One is called as primary cartilaginous joint and other is called as the secondary cartilaginous joint. Primary cartilaginous joint is also called as a synchondrosis and secondary one is called as a symphysis. This thing is asked in the MCQ. Symphysis means secondary cartilaginous joint, synchondrosis means primary cartilaginous joint. Okay, now one by one. First one, classification is called as a primary cartilaginous joint. So what is primary cartilaginous joint? This is the one bone, this is another bone, and this bone is connected by one plate of cartilage, and that is called as a hyaline cartilage. This is bone and this is bone. So primary cartilaginous joints where bones are connected by a plate of hyaline cartilage, and this is called as a primary cartilaginous joint. Okay, they are mainly immovable joints, and the examples of the primary cartilaginous joint is the joint between epiphysis and the diaphysis of long bones. Okay, so what is epiphysis? That is the end of the long bone. Okay, diaphysis is nothing but the shaft of the bone, that is called as a diaphysis. And between this epiphysis and diaphysis there is a plate of cartilage that is called as epiphyseal plate of cartilage. And this epiphyseal plate, so it is a junction between the epiphysis and diaphysis, that is called as a example of primary cartilage. They meant for the growth of the bone. Okay, once the bone growth lengthwise completed, this epiphyseal plate of cartilage is converted into a bone. That is first example. Second example is the spheno-occipital joint. Spheno-occipital joint. Third example is the first, okay, chondrosternal. First chondrosternal. So first costal cartilage and the sternum, the joint between this. So this is the body of the manubrium of the sternum. This is the body of the sternum, and this is the first costal cartilage, and then there is the first rib. Okay, the joint between this costal cartilage and the manubrium, that is called as the first chondrosternal. All costochondral joints. This is the fourth example, costochondral. So this is the costal cartilage and then there is a rib. Costal cartilage and then there is a rib. So like this is the example costochondral joints and the sternal joint between the body and the xiphoid process of the sternum. Okay, so this is about the primary cartilaginous joint. What is primary cartilaginous joint? It is a joint where two bones are connected by hyaline cartilage. Okay, they are mainly immovable joints. They are temporary joint, disappears after some time or with the age. Okay, so example is the joint between the epiphysis and diaphysis. So any long bone shaft is a diaphysis and epiphysis are the ends. In between them there is a cartilage, the primary cartilaginous joint. Second example is the spino-occipital joint. Then first chondrosternal, ये MCQ में याद रखा, first chondrosternal joint and all costochondral joints between the rib and the costal cartilage and the xipisternal. These are the 5 examples of primary cartilaginous joint. Then secondary cartilaginous joint. Secondary cartilaginous joint. So what is secondary cartilaginous joint? It is also called as the symphysis, where the two bones are covered by this cartilage, articular cartilage, and then they are joined each other by this fibrocartilage. Okay, so that is the structure of the secondary cartilage. The two bones having a covering, that is called as the hyaline cartilage. Okay, and that is called as the articular cartilage, and then these cartilages are connected each other by the fibrocartilage. Such a structure is called as a secondary cartilaginous joint. So bones are covered by the hyaline cartilage and united by the fibrocartilage. They are slightly movable. Okay, some movement is possible at these joints. Okay, they are permanent joint. They are not replaced by the bone, so they are permanent joint, and they mainly occur in the midline of the body. Okay, which are the examples of the secondary cartilaginous joint? In the example, there is a symphysis pubis. Between these pubic two bones there is a symphysis pubis. Then intervertebral disc between the two vertebra, body of the vertebra. Then between the manubrium and sternum, manubristernal type of joint, and between the two mandibles there occur symphysis mendi. This later on converted into a bone to form one complete mandible. Okay, secondary cartilaginous joints typically occurs in the midline. Okay, so what is secondary cartilaginous joint? Secondary cartilaginous joint, what you have to write? These are the bones are covered by a hyaline cartilage and united by a fibrocartilage. You have to draw this kind of diagram. What is the characteristic of secondary? They are slightly movable. Some kind of movement is possible. They are permanent joint, not replaced by the bone. They occur in the midline, and examples are the symphysis pubis, intervertebral disc, manubriosternal joint, and in case of mandible, symphysis mendi. So these are the examples of the secondary cartilaginous joint. Okay, so that is the short note on the cartilaginous joint. If they are asked question difference between the primary secondary cartilaginous joint, you have to make a table what is primary and secondary cartilaginous joint. So आपको इस तरह से टेबल बनाना है. यहाँ पे लिखना है प्राइमरी, यहाँ पे लिखना है सेकेंडरी कार्टिलेजिनस जॉइंट. पहले तो दोनों का डेफिनेशन लो. प्राइमरी कार्टिलेजिनस जॉइंट, टू बोन्स आर connected by the hyaline cartilage, two bones are covered by the articular cartilage, and then they are connected by the fibrocartilage. Okay, they are immovable, slightly movable. Okay, they are not permanent joints, later on converted into bone. These are the permanent joints. Okay, these are some characteristics. Okay, they secondary occurs mainly in the midline, not always. Okay, in example you have to write the primary cartilaginous joint example, joint between the epiphysis and diaphysis. Okay, spino-occipital, first controsternal, costochondral joint and zipisternal joint, and in secondary you have to write the pubic symphysis, intervertebral disc, manubriosternal joint and symphysis menti. Okay, and then you have to draw the diagrams like this. Okay, that's it, the question. You will get a good marks in it. Okay, thank you very much.